Pregnancy is supposed to be a joyous occurrence. But in developing countries such as Malawi, it is a source of apprehension, especially in rural communities. Malawi is one of the countries with high maternal mortality rates. Severe bleeding, infection, eclampsia, and obstructed labor are some of the causes of the maternal mortality. At least 807 mothers die in Malawi out of every 100,000 live births. A team from United Nations Population Fund, UNFPA, visited some of the hard-to-reach areas of Malawi to appreciate the challenges nurses and midwives encounter in their effort to provide quality maternal and child health care services. Chapananga and Dolo health centers, situated on the southern tip of the country, are some of the health facilities in hard-to-reach areas. Esther Lizengo is the only nurse midwife at Chapananga Health Center. She has been there since 2009 and handles on average 4 deliveries per day.
Besides deliveries, Monday is for women who come for first antenatal booking. Tuesday is for subsequent booking, while Wednesday is for family planning and ART clinic. Thursday, I'm supposed to have mobile clinic.
The mobile clinic services have been suspended for months now because their motorbike broke down. Infection prevention is another challenge. There is short supply of gas for sterilization of kits in the maternity ward. The health center has no electricity. Pregnant women are required to bring on paraffin lamps or candles. Most deliveries take place at night. There is also no running water, a situation that forces patients to share a borehole with villagers. A similar situation prevails at Dolo Health Center, where Leno Malinda is also the only nurse midwife technician. On arrival in 2004, Malinda had to double as a medical assistant and nurse midwife.
At that time, there was no medical assistant. For 4 years, I was doing everything.
Like Esther Lizengo, Malinda is usually overstretched because of work overload.
There is a staff shortage here. As a result, I work day and night.
I don't rest. I don't have access to TV or internet. How can I watch TV when there is no electricity?
These health workers also face challenges in communicating with referral health facilities. And sometimes they use their own mobile phones to call for an ambulance. They wait for up to 5 hours.
Our road becomes impassable during the rainy season, and the ambulance doesn't come here.
What happens in such a situation?
People carry the patients up to the main road to wait for the ambulance.
Nyokase Kaimira is District Nursing Officer for Chikwawa.
Indeed, whatever problems you've observed in our two health facilities, that's Dolo and Chapananga, it's really the true picture of what is happening, not only in Dolo and Chapananga, but almost in most of these hard-to-reach health facilities. Both Dolo and Chapananga, nurses are refusing to go there because of the condition of rest houses, water problem, electricity. Everybody these days wants to watch television, and no electricity, that means no television. So they are refusing to go to those facilities.
Juliana Lunguzi works at UNFPA.
This is an eye-opener to say that we really need to rethink in our country program to say how do we continue these kind of services to make sure that referrals are made on time, because as we have heard from Chikwawa, they don't have enough ambulances. And this is typical of any other district where we support as UNFPA, that we need to support in these areas. The same, we also need to see how can we support in the areas of communication and in the areas of water and electricity, because when you don't have those amenities, it's a challenge to have midwives who would want to go and work in those hard-to-reach area and be able to provide those services. The other thing that we're doing as UNFPA is to do targeted training of midwives. This is one of the areas that we want to do with CHAM, to say, okay, is it possible that we can support the young girls and boys who come from an area so that they can be bonded using the traditional authorities and the hospital, so that once we train them, they'll be able to go back in their community for a specific period. In that way, we can retain some of the human resource in the hard-to-reach area, because this is one of the main challenges in Malawi. We're able to produce midwives, but for them to stay in the rural area. So these are some of the strategies we need to try out and see what can we to make sure that we retain quality, provide health skilled birth attendants in the rural areas.
Making births safer in Malawi should involve overcoming financing barriers for rural health facilities, improving access to care, and by increasing the number of skilled birth attendants.